Hey, what's up, everyone? It is your host, C.W. Hall, Charlie Whiskey, with you again today. And 8 years ago, I got to meet a cardiologist named Ali Rahimi on a show I was hosting at the time called Top Docs Radio. And back then, we were talking about the management of hypertension and going about that process for a disease that's affecting many, many, many people. And today, I'm happy to have him back with me on Kinetic Innovators because he is doing just that. He is innovating in how patients can help, on some extent, managing themselves, particularly those that are dealing with cardiometabolic diseases, heart disease, heart failure, hypertension, diabetes, all the types of diagnoses that are associated with cardiology and beyond. So, Dr. Rahimi, thanks for making some time today to tell us about Alyka.
My pleasure, CW. It's nice to see you again.
Well, before we were talking about hypertension, and obviously some of the patients that we're, talking about being, the ones that might want to take a look at the application that you've built out here. Tell us a little bit about this application that you call Alyka. Where did the name come from?
Yeah, well, in the end, and ultimately, what we're all striving for is to help improve the lives and health of our family, of our community. So Alyka stands for the initials of my family. At the end of the day, that's what motivates us. Our team, we believe everyone has their own Alyka. That's what you're working towards. And our logo has a pathway that goes up and forward to the sun. So whatever is most important to you. And so, the impetus behind this really is seeing an opportunity where we can do better for our patients and our community. We have done so much in medicine and helped so many lives, but yet there's this great opportunity. And, we believe that providing patients with greater self-agency, understanding of their health data and their conditions, we can move upstream the prevention of disease, particularly heart disease, and truly save lives.
So let's talk a little bit more specifically about Alyka. It's an application now that's available on the Apple Store as well as the Android, Google Play stores for the Android phones, and it's something you can download to your device. Tell me more about that and what inspired you to bring it about to begin with?
Yeah, so we believe that, we understand that there is a gap. Our patients see us a couple times a year, and between primary care specialists, even if they're enrolled in a remote patient monitoring program or a chronic care management program, that's still limited touches. So maybe 350 days a year go by, they have no interaction. Where do they go? We know 80% of our patients, when they leave our offices, have a misunderstanding of their condition, can't grasp their medications and the why, and then they go home looking for answers. So we've failed in the care experience and in closing that knowledge gap. And now 1 in 3 searches today in GPT are a health-related question. That's why I say we can do better. And now with the portability of health data and the, increasing, whether it's your EHR, your devices, your wearables, that data creates an opportunity for knowledge, but yet without context, the timeliness of it that's available to them, then what do patients do? Where do they go? And we believe we wanted to create a resource that can fill those gaps, that can be the digital extension of the care team that every patient goes home with, that is evidence-based, science-backed, private, without any advertising or marketing, and it's done in the best interests of our patients.
So through the application, if I'm a patient, I've downloaded, or maybe I'm a loved one, I have older parents, and they're, they have some devices, or they monitor their blood pressure, that kind of stuff. I can see this and maybe communicate through the application with their doctor or doctors if they're included in my circle, if you will.
Yeah. So so today the application, largely it is a patient-facing solution. It is an app that can be downloaded on the Apple Store or Google Play. What we did originally was we, opened it up to the entire world. Really, we had downloads from the UK, Canada, anywhere that's English speaking. We opened that access to, and we gained a lot of learnings and insights and understanding what is it that the consumer wants in terms of design, the experience, the content, and gaining an appreciation for that and optimizing for that. And we spent really many years, trying to raise engagement and appreciation for the app. And then we made the decision that really the opportunity to get this in the hands of the patients, it's best to go through their clinics, through their providers, their physicians, or those who are taking care of them, whether it's a clinic, a hospital, or health system. So now we are working with the provider end, and cardiovascular practices, primary care, providing this as a resource to their practice that they promote and to their patients. This is what they go home with, not just a black and white after visit summary. And that's where they gain their engagement and self-agency to take better care of themselves.
So my doctor is saying, hey, Charles, while you're sitting here, I want you to download this app. I'll help you do that. And they're putting it on their device. And from what I remember when we were first talking about it, I can at least enter. I don't know if it's communicating with devices that might be being used for remote monitoring. I don't know. You can tell me if it's doing that now. But from what I understand, I can share actual data that I'm getting. My blood glucose, my blood pressure if I've got hypertension, and I'm monitoring that. Various data from my daily experience that I'm tracking, I can actually share it in here with my doctor.
That's right. So really, we wanted to create an interface that first and foremost, the most important person that needs to hold the football and own it is our patients. I can speak as a practicing cardiologist. We are overwhelmed with the communications that we get from our patients and in trying to answer them timely. We are having to hire more operational resources and staff to contend with the millions of emails that are coming through. There was a study that was just done that since 2020, the number of in-basket messages coming has increased by over 150%. So the goal is not to have more data go to the doctors. The goal is to provide that data. So it's self-reported. There's surveys and that ask the individual, about exercise, nutrition, stress, sleep, alcohol, tobacco use. We go in and have an appreciation of their risk factors. Are they overweight, obese? Do they have pre-diabetes, diabetes, hypertension, high cholesterol? Do they have heart failure? They have coronary artery disease, AFib. So from primordial prevention all the way to the secondary, tertiary management of cardiovascular conditions and its risk, which is very prevalent. 80 to 90% of individuals who are 65 and older have one of these risk factors or conditions. So the first point is, this is what folks go home with, and no different than how we advocate. Are you taking your medicines? Are you checking your blood pressure? Rather than simply sending them home with an after visit summary. The messaging is, Betty, you're going to go home with this application. It's an extension of our care team. This is where you go to understand conditions and how to manage yourself. It allows you to connect with the EHR, so it'll pull in their data from the EHR. You can connect to their wearables or Apple Watch. It'll connect to the blood pressure machine, other devices. And now that data lives in one place, not multiple apps, but in an area that's dynamic, interactive, that they can interact with on a day-to-day basis to help them get better. And then when they come to the office, all the vitals and all that interaction is on their phone that they can then share with their doctors.
And in addition to that, you mentioned when we first started chatting today, you talked about context relating to both the data that I'm acquiring through the use of these various devices in my home, but Alyka will then be able to present me with some educational type material that helps me, the type of educational information that's very difficult to have time to go through while I'm sitting in an office. A lot of times there's just not a lot of time to really cover all of this. That's part of what it's supplementing my experience with, is some very well produced content that helps me better understand, what does this mean for me? What does my blood pressure reading mean? What is cholesterol doing to me? How does nutrition affect? Talk about the content that you're giving me in between, and because I understand you're gamifying that a little bit so that you can kind of tell, did I do my homework or not in between visits?
That's right. So we took a look and said, where do our patients go before they come to us and when they leave our office? Where do they spend their time? They're on their phone. They are looking at social media apps, gaming apps, entertainment apps. So we studied those applications and said, what would digital health entertainment look like? What would an application look like that's evidence-based, science-backed, without marketing, no accepting of cookies, it's private and secure, but it's multimedia. So we bring the latest content and we flip it into a 6th grade reading level that's available, very short and concise, that keeps the attention of the user. There's recipes, there's video, there's trivia, there's factoid. So all sorts of different types of content, knowing and understanding that there's different users and different tastes, and it's interactive. So we understand what they use and what they like, and then it can trigger more content like that. And also regarding their vitals, so they check in for their blood pressure or their goals, and for their conditions as it changes, and that will then again trigger more content. So in a very safe manner that's intended to improve the quality of care, improve health outcomes. We want to improve medication adherence. We want to improve blood pressure, LDL, A1C, and can ultimately keep people out of the hospital and help them live a longer, healthier, happier life.
And as I use the application and I'm consuming the material that it's presenting to me, when I come to visit you again in the office, you can actually kind of see what progress have I made in terms of the materials that I have viewed, and have I been kind of learning about what's going on with my illness? You can see all that as the physician managing me, right?
That's right, because we recognize folks like to stay entertained and create competition, and understanding that it's hard losing weight. It's hard waiting for your cholesterol or blood sugar, A1C to come down. It's hard taking care of chronic conditions. It's a very long timeline. But what if every week, as they consume more content and enter their vitals and did the right thing, they're earning, what we call Ally points. And after they earn so many points, they go up a level. So now when I see my patients, or someone sees their patients, they can see as a surrogate, while we're waiting for those improvements, that are they staying engaged in their care? Are they going up levels? Are they adding points, if you will? And so this is an opportunity for that gamification. There's streaks, they can double the points. So again, a way of keeping folks entertained, they're interactive, and there's a community that we build so they can share, who's at what level. But if someone's staying at the same level, I guarantee that that's a person that's not engaged in their care, that may be at higher risk of not taking their medicines, not showing up, not making that fill, and that provides an opportunity where we can intervene.
We talked about the fact that it's available on the Apple App Store as well as the Google Play stores for those types of devices. Is it pretty much cardiology patients? Who should consider downloading this application to their devices?
So it stretches the continuum from primary care. So if you think about primary care, they are the foundation of healthcare in our country, or anywhere. So from risk factors, again, around behaviors, nutrition, exercise, stress, sleep, alcohol, tobacco. So that's major. There is an app, multiple apps for each one of those. This is all in a single place. Then individuals that have these conditions like high blood pressure, prediabetes, diabetes, high cholesterol. Again, we address that, and that's in, if you will, primary management. And then secondary conditions are more chronic. What happens if you have uncontrolled diabetes or uncontrolled high blood pressure? Well, you develop heart disease. You now have diabetes. You have chronic kidney disease. You have heart failure. You may, God forbid, have a heart attack. So we address that as well. And then we also continue the continuum for post-acute care. So if you were hospitalized for heart failure, if you had a stent, or if you had an ablation, so we really go across that whole continuum. So we would say from primary care, so across cardiology, if there are practices that are nephrologists or endocrinologists, again, there's value there. But again, today, the main way that individuals can get out access to Alyka is through their practice, having their physicians kind of promote it. They can download it. The biggest news for us is we've been approved in the Medicare Access model. This is an opportunity for anyone who has traditional Medicare. Anyone who has traditional Medicare can get Alyka without any charge, no charge to the practice, no charge to the patient. We've waived the patient copay, so more patients can use this and get healthier. So for the Medicare population, that's where our focus is today for the population level approach.
That was kind of getting to one of the questions I was going to ask. So if I'm not Medicare, is there some kind of a subscription for me to use the application, or is it coming through my provider's office, my doctor's office?
Yeah, so today we're focusing in on the Medicare population, the 65 and older. Of those individuals who have used Alyka, the average age is anywhere between 50 to 55, plus or minus 15 years, if you will, 15 to 18 years. So, again, anywhere between someone who's between 40 and 80 years old is probably the sweet spot. We will work with practices and health systems that would like to have a conversation to see how can they provide this for their patients, both who are on Medicare. In that instance, the practice and system does not have to pay it because Medicare is reimbursing for it. And indeed, for every person they refer Medicare, they can bill Medicare for up to $100 per beneficiary. Commercial population that's under the age of 65, that's where we have the conversation and kind of figure out terms that works for the clinic and the health system that they can then provide this as a resource. Ultimately, our goal, and we say this is 10 million hearts in 10 years, we're very ambitious about this goal because it's necessary. It's critical that we reach as many hearts as we can as quickly as we can.
So if I'm a practice group or even a health system, whatever the case, I just need to reach out to Alyka and say, hey, we heard about your application. We want to make it available to our patients. And then you have somebody that will get with them and describe what that looks like. Yeah,
really, they would contact us. They can go to our website, alykahealth.com, find the supporter information, and they can schedule a meeting. We'll reach out to them and show them the live demonstration, go and understand their priorities, their operational challenges that they may be having, and quality outcomes and patient experience. And then most equally important is to help them operationally unload their staff. We are seeing upwards to a 20% reduction in in-basket messaging and phone calls that are coming to the practice because now patients have a resource that they can go to. So we want to elevate the care experience, improve health outcomes, lower the operational burden and costs for the practices, and now, at least for the Medicare population, there's a revenue opportunity for them too. So, anyone who's interested, we'd love to have the conversation.
How are your patients receiving it? Are they giving you feedback about the content? I've seen some of it, when we've talked about Alyka in the past. It's obviously very elegant material that you're putting out there. What are your patients saying as they start to use it?
Yeah, so the folks that are using this in different parts of the world, parts of the country, are interacting with it very nicely. This becomes part of their morning coffee routine or their lunch routine. It feels like a form of social media. They're interacting with it. It's multimedia, different types of content. We are looking at the back end where people are spending their time so we can iterate and make adjustments. They can bookmark things and share with their friends or family if they can like it, you know. And then all that we use to iterate on the content, the user experience. And we have focus groups with our members who are using it and gaining an appreciation. So if we have an idea, we put it in front of them first, not, you know, so they need to approve it and like it. And then we listen to them intently to understand what's missing and how we can continuously do better.
What are your final thoughts before we let you get back to the rest of your afternoon?
Well, I say, you know, first, thanks for letting us share this story. You know, we have come a long way in healthcare. We've addressed many knowledge gaps in science and discovery. We have printed out and published guidelines and literature in countless journals and publications. But yet there's an opportunity. And I think the time is now to give greater self-agency to our patients, empower them, engage them, and let them lead. That is the greatest opportunity in healthcare. We need to flip the pyramid, get in front of prevention across the whole spectrum, and we will really save lives and do good by our community and country. So I'm really excited for the months and years ahead, and look forward to sharing updates with you.
The website is alykahealth.com.
AlykaHealth.com.
ALYKA health.com. You're on all the socials, I would imagine.
Yep, we're on LinkedIn, you know, Facebook, various different sites, and they can visit our resources page on the website. We've got all sorts of different materials there as well that they can take a look at, and I encourage individuals to have that conversation. We need to continue to innovate, and those practices that do will stay ahead, and we'll have the best care experience and outcomes for their patients, and you know, be noted as such in the industry. So we look forward to meeting lots of folks in the coming weeks and months.
I'm very pleased to have you back with me on the program, Dr. Rahimi, and it's been nice to be able to talk about what you're doing with this cool application, helping patients better understand and better manage their complex cardiometabolic diseases. It's obviously being in front of them and presenting them with more information all the time, every chance you can. This is one of those things that's going to be helping fill that. I'll certainly be letting people that I know in the cardiology space know about the application for sure, and say, hey, you might need to talk to Dr. Rahimi. So I appreciate you joining me again today.
Thank you, CW. I hope you have a great rest of the day and enjoy the 4th of July.
If you all haven't done so already, make sure you subscribe to us. We're on all the social media that you're probably following, including Spotify if you want to follow the podcast out there. We're on LinkedIn, obviously YouTube, Facebook, X, Twitter, and TikTok. So we are where you are, and we're glad you made time to make us a part of your day today. Dr. Rahimi will be talking to you again real soon, I'm sure, to catch up and see how things are going with Alyka Health.
Thank you, CW.
We'll see you all next time.